Good afternoon. My name is Malgorzata Bala. I come from Jagiellonian University Medical College in Kraków, Poland, and I have the pleasure to present preliminary results of our study on behalf of our international team, including Tina Poklepowicz-Pericic, Wilein Motaze, Anke Rochwer, Joanna Zając, Maria Franka-Żuliewicz, Nancy Czacic, and Darin Young, coming from Poland, Croatia, South Africa, and Cameroon. I have no conflict of interest in relation to this presentation. The background for this study is coming from our earlier overview of systematic reviews on evidence-based healthcare teaching, in which we observed the inconsistent reporting of studies. This is also drawn upon concept presented at the Global Evidence Summit in 2017, which served as an exploratory pilot study for our study, which was based on e-learning for evidence-based healthcare collaboration review published by Anke Rochwer and co-authors. The aim of our study was to assess whether the completeness of reporting of studies on evidence-based healthcare e-learning intervention using GREET, meaning the Guideline for Reporting Evidence-Based Practice Educational Interventions and Teaching, improved over the past 5 years. The GREET checklist, published in 2016, includes 17 questions. For each question, possible answers are yes, no, unclear. They cover the name of the intervention, why, with theory, learning objectives, evidence-based practice content, what, meaning materials, educational strategies and incentives, who provided, how it was delivered, where it was delivered, when and how much, planned changes, unplanned changes, and how well it was implemented. Our research strategy and inclusion criteria are based on Campbell Review on Evidence-Based Healthcare e-learning. We searched several databases. We included studies such as RCTs and non-RCTs on healthcare professionals at any level of education, which assessed any type of evidence-based healthcare educational interventions, either pure e-learning or blended learning, compared with no educational intervention or other types of educational interventions on any types of evidence-based healthcare outcomes. We compared studies published before and after May 2016. From previous searches, we had 24 studies. You can see the study flow on the right-hand side, and on the left-hand side, we present the study flow for the update. Since 2016, we started with over 16,000 records imported for screening and ended up with 11 studies which met our inclusion criteria for this study. Here on the slide, you could see the detailed results for the studies published up to May 2016 on the left-hand side, and for the studies published from June 2016 up to now on the right-hand side. For each grid item, you could see yes responses in blue, no responses in orange, and unclear responses in green. These are numbers of studies with each answer. And as you can see, in both groups of studies, we could see a lot of orange color. So a lot of items were not properly reported. This is especially with regard to the implementation, so how well, and some other details. We compared the compliance with each item of grid checklist, which you could see on the slide here. These are percentages of studies for which we had answer yes for each grid item. In blue color, we present the group of studies published up to May 2016, and in red for studies published from June 2016. we could observe some changes in the last 5 years, mainly with regard to item 2, theory, item 3, learning objectives, and item 15, learners' attendance. On the basis of our observations, we conclude that studies assessing evidence-based healthcare e-learning fully reported on their interventions, and the situation has not changed much in the last 5 years. Thank you for your attention.